Hi everyone, Dr. Obi from Pain Free and Fit and Walkaway Back Pain. Today, a great video on downhill walking exercises to help with disc herniations, degeneration, and bulges. Hope you enjoy. So if you've seen any of our other videos on the channel about disc herniations, bulges, and degeneration, you know that one of the central themes we've discussed with various helpful exercises is the idea of introducing more spinal extension into your spine. Discs, although each case is different to the individual, most disc problems are aggravated with flexion, meaning bending forward, whether we're slumping in a seated position. Remember, sitting puts more pressure on the disc than standing does. Or whether we're involved in activities where we're leaning forward or bending forward from the waist as opposed to the hip joint with a neutral spine, that flexion has a tendency to compress the disc and drive the inner part of the disc, the nucleus, backwards. When that disc inner material pushes backwards, it irritates the bulges and the herniations. It also irritates degenerative disc disease. So extension, or training the muscles to create an arch in your back, actually does the opposite. When we extend the spine, it compresses the back portion of the spine, and as long as that compression is not too great to irritate the nerves and the posterior disc fibers, as well as the facet joints, that posterior or backwards compression actually helps to push or migrate that inner disc nucleus fluid back towards its centered position. And that's why exercise programs that emphasize extension are many times helpful in disc patients. Now, one of the things about rehab exercise is that a lot of patients, unless you're motivated and you have a good, strong background in fitness and exercise habits, it's tough to stay consistent with extension training. That's why a lot of my patients come back after I've given them the corrective exercises, we resolve the symptoms, and they say, you know what, I got away from my exercises, I started slumping again, and all of a sudden my symptoms have been returning. That's one of the reasons I developed the Walkaway Back Pain program. Great way to include spinal extension exercises and corrective exercises for all types of back conditions simply by tweaking or modifying the way you walk. We all walk anyway every day, so why not learn how to modify it for your unique mechanics and to improve your spinal conditioning to help relieve your symptoms. We're going to take an excerpt from my book, Walkaway Back Pain, today and talk about downhill walking for disc problems. When we are on an incline facing downwards, the natural tendency for the body is to fall forward. Gravity wants us to do that. So the way we resist that unconsciously is we stay a little bit more upright. We literally extend the low back. We increase the arch of the back. As we position ourselves downhill, the pelvis starts to rock forward into an anterior pelvic tilt. That tailbone then comes higher than the pubic bone, inducing an arch in the back, and our upper body, in an effort to avoid being forward, starts to stimulate the extensor muscles in our spine, which hold us upright. Those two mechanical factors help to increase that arch. As you do that and you walk downhill, you actually cause that disc material to start moving forward, recentering disc material and decreasing many times the symptoms of disc herniations, disc bulges, and disc degeneration pain. One of the things you have to keep in mind with downhill walking, whether it's outside on a hill or on a down treadmill, is you have to make sure that the extension is not too great. If the angle of the incline is too great, you may actually feel an irritation in your lower back or irritation of the sciatic nerves down into the legs. So one of the things we want to avoid with that, or help with that, is by using a little bit of counter pressure with the pelvis. As we walk downhill at an incline, if the angle is too great and you can't change it, let's say you're outside or your treadmill is set at a certain angle, you want to make sure that you include a little posterior pelvic tilting where the tailbone tucks under just a little bit and the pubic bone up by using your abdominal muscles. Although you still have an increased arch compared to standing flat, it's not as much of an arch. So you can monitor that in terms of your symptoms and how you feel. You should put the pelvic bone under just enough to relieve symptoms and feel comfortable as you're walking. Remember also all your other stability points to create a neutral spine. If you don't know what that is, we have many videos here on the channel, and all of our programs at the painfreeandfit.com website have the ability to teach you how to self-analyze yourself and correct hip problems and rotational, lateral flexion, and translation problems in the way you hold your spine, as well as dysfunctional muscles like the multifidus and the abdominals, how to contract them uniquely for you, because we all have a different neutral spine and need different mechanical corrections for our back pain. Taking this idea of walking downhill, you can use this several times a day to relieve pain. Even going on the treadmill for 5 minutes
multiple times a day in a down position or literally standing on an incline can many times help relieve disc pain. You can use this as a conditioning exercise where you build up the time or the amount of steps that you take on a treadmill or outside downhill walking over a course of weeks and months. That's going to condition more of these extensor muscles, which over time is going to help with back pain. Much of the research on disc herniations, bulges, degeneration show that endurance training, especially the extensor muscles, helps relieve symptoms. If you like this video on downhill walking for disc herniation, bulges, and degeneration, feel free to subscribe to our channel. We got a lot of great videos out there to help you. Thumbs up to help me share this valuable information with others. As always, I'll do my best to entertain your comments or questions. Just write in. And remember, if you're looking for a great, easy program to include your analysis of your mechanics that are affecting your back pain and the corrective exercises while you walk around during the day, check out our Walkaway Back Pain program available at painfreeandfit.com. I hope this video on downhill walking for disc problems helps you with your chronic back issues.